Dr. Daniel, a forensic psychiatrist with decades of experience in mental health and psychiatry. Today I'm going to speak about suicide prevention in jails and prisons. For example, a 24-year-old young man was convicted of a minor offense and sentenced to 3 years in a minimum security prison. By his rule-breaking behaviors, he ended up getting more and more restrictions and landed in a maximum security prison. His family rejected him if he is paroled. This broke the proverbial camel's back. Frustrated with the fact that he has to serve the entire 3 years instead of the customary 85% of the time, he took an impulsive action to hang himself. Take the case of a middle-aged white woman, 55 years old, first time in jail, convicted of an offense of killing her husband, which she thought was unjust because he was extremely violent and abusive. He was in fact atrocious. Overcome with guilt, she used a sheet in her cell and hung herself. Women more often attempt suicide compared to men who often end up killing themselves more than women. Take the case of a middle-aged man, well respected in the community, had a secret private life of one of sexual exploitation of his stepchildren. He became extremely depressed and ended his life. Imagine the personal joy of saving one's life, especially someone behind bars. Suicide in jails is the #1 cause of death in jails and the 3rd cause of death in prisons. Prison officials, especially correctional officials, have a duty to protect inmates, a duty bestowed upon them by the state. Many suicides can be prevented if the correctional officials recognize the feelings and behavioral changes of a suicidal inmate, and if they follow policies, procedures, and practice in their facility. Inmates are one of the highest groups for suicide, especially if they have attempted suicide before. Suicide attempt, a near lethal suicide attempt, is the single most predictor of suicide in a facility. Detainees have lost many things in their life, particularly their family, their children, their dignity, above all, their freedom. Maybe because of their lack of judgment, poor decision-making, maybe because they have been substance dependent, maybe they are facing a long sentence being trapped in the setting, maybe because they are mentally ill. 20% of all inmates in our system have serious mental illness. 60 to 90% of the suicidal inmates have one or more identifiable psychiatric disorder. They could be major depressive disorder, bipolar affective disorder, or psychosis, or any number of disorders. Substance abuse is a significant risk factor for suicide. For those who are substance abusive, the first few days are extremely vulnerable. For the alcohol dependent, is the first 3 days in the jail. For the opiate dependent, it is up to 7 days. What is the predominant mental state of a suicidal inmate? What I have seen in my personal experience, Most of them are anxious, depressed, agitated, sleepless, but above all, they have feelings of hopelessness. In this state of mind, when a psychosocial stressor occurs, while they are in the facility, in the prison or jail, that will act as a catalyst for suicide vulnerability. The most significant psychosocial stressor is death of a loved one, loss of custody of the children, or a new sentence, or a harsh sentence while they are in the system, or a movement to a maximum security unit. When the psychosocial stressors interact with the stable risk factors, such as the type of convictions and mental illness and the fact that they are taking some medication, when these two interact, that increases the suicide vulnerability of that individual. Keep in mind, all suicidal thoughts are transient, short in duration. So that opens the door for active intervention by people around. What can we do? What can the system do? What can the correctional officers do and mental health professionals do to have a positive impact so that the suicides can be reduced or prevented? First of all, facilitate communication with the suicidal inmate. And listen to their concerns, their conflicts with empathic listening. Help them to reframe their thinking. This is known as cognitive reframing. And cognitive reframing is the primary principle of cognitive behavioral therapy, otherwise known as CBT in common terms. CBT is expensive and time-consuming, and that's not easily available in jails or prisons in our country because of lack of resources and budgetary constraints. So beyond supportive therapy and cognitive CBT, what can the system do? What can the correctional officers do? First of all, suicide screening is important. Suicide screening is mandatory in all jails and prisons. But the problem is that it is usually done in a cursory manner, usually done by the correctional officials who may not have adequate training. So training is important in that respect. The suicide screening instrument must be carefully selected, and that must contain, or that might should comprise of the known risk factors. And of course, the correctional officials have to maintain the safety and security of the facility. That's an important concern. But once the suicidal inmate is identified or at-risk inmate is identified, the next step is suicide risk assessment. That is usually done by a mental health professional upon referral from the corrections officers. So suicide risk assessment is an in-depth process, taking into consideration all the known risk factors of that individual vis-a-vis protective factors of that individual. Of course, once an at-risk inmate is identified, then you have to monitor them by placing them on suicide watch. And of course, there are different levels of suicide watch in our system, and then provide treatment. The treatment is a significant component of suicide prevention. Medication management of the mentally ill is a significant suicide prevention tool. Next, for the inmates to have access to mental health care. Of course, Supreme Court cases have laid the foundation for access to mental health care, suicide prevention program, etc. Establishment of a comprehensive mental health delivery system is critical. Then the correctional officers must follow, including the mental health professionals, all of them, the team has to follow or comply with the policies, procedures, and practice. Non-compliance with these are fatal. So that is a significant component. Finally, the administration of a jail, of prison, must create an atmosphere of an attitude or belief that suicides can be prevented. And with these measures, we can reduce the number of suicides and save lives. Thank you.
Dr. Daniel offers such a valuable service to humanity. Helping those who often have the least help is really heroic. And it's a tender subject, and oh boy, it's such a tough subject to talk about. And yet he informs us, he'll inform professionals, and so many people will be able to move to solution and hope. Thank you, Dr. Daniel.
Dr. Daniel's speech was so incredibly knowledgeable and insightful. I think it has many, many implications for policymakers, for educators, as well as mental health professionals and doctors. My biggest takeaway was the difference that we can all make between hopelessness and hopefulness in terms of preventing suicide. It was magnificent.